Before performing any statistical analysis, it's essential to understand your data. This process is called exploratory data analysis, or EDA. In public health research, EDA is a critical first step because it allows us to understand the structure, quality, and distribution of our data before making any inferences or modeling decisions. In this video, we'll generate summary statistics, examine distributions, and explore patterns in a public health dataset. We start by loading the necessary libraries, dplyr for data manipulation, and readr for importing the dataset. Once the dataset is loaded, the first thing we do is examine its structure using str and generate summary statistics with summary. This step is foundational. It helps us understand variable types, whether they are numeric, categorical, or factors, and gives us an initial sense of central tendency, spread, and potential missingness. In public health datasets, misclassified variables or unnoticed missing data can substantially bias downstream analyses. Summary statistics provide a quick overview of numeric variables. We typically examine measures such as the mean, median, minimum, maximum, and standard deviation. These values help us understand the central tendency and variability in the data. We compute the mean, median, and standard deviation of BMI. In a public health context, BMI is a widely used indicator for overweight and obesity, which are risk factors for cardiovascular disease, diabetes, and other non-communicable diseases. Looking at both the mean and median helps us assess skewness. If the mean is substantially higher than the median, for example, that could indicate a right-skewed distribution driven by extreme values, which is common in BMI data. The standard deviation gives us insight into variability, which matters because greater dispersion may reflect health inequalities within the population. We then summarize multiple variables at once: mean BMI, mean age, and mean systolic blood pressure. These are core population health indicators. Age is a major confounder in almost all epidemiologic analyses, and systolic blood pressure is a key risk factor for cardiovascular morbidity and mortality. Understanding their baseline distributions helps contextualize disease burden and informs subsequent stratified analyses. Next, we move to frequency tables. For categorical variables, frequency tables show how observations are distributed across categories. This is especially useful for variables such as sex, smoking status, or disease status. Frequency distributions help us understand population composition. For example, if one sex is overrepresented, that may affect the generalizability of findings. Similarly, examining smoking status is critical because smoking is a major behavioral risk factor linked to cardiovascular disease, cancer, and respiratory conditions. We also calculate proportions for smoking status. Proportions are often more informative than raw counts in public health because they allow us to compare across populations of different sizes and assess prevalence, a core epidemiologic measure. In public health, we often want to compare groups. For example, we may want to examine whether BMI differs between males and females. Grouped summaries allow us to explore these differences. First, we calculate the mean BMI by sex. Stratified analysis like this is essential in public health because risk factors and outcomes often differ across demographic groups. Identifying differences in average BMI by sex can point toward underlying biological, behavioral, or social determinants of health. Next, we calculate the mean systolic blood pressure by smoking status. While this is not a causal analysis, it provides early signals that may warrant further investigation through regression modeling or longitudinal study designs. EDA at this stage helps generate hypotheses. For example, do smokers show higher average systolic blood pressure? If so, is this relationship confounded by age? These are the kinds of questions exploratory analysis is designed to surface. EDA also helps identify potential problems such as extreme values, unexpected categories, or unusual distributions. Detecting these early helps prevent errors in later analysis. Extremely high or low BMI values, for example, could represent true clinical extremes, such as severe obesity or malnutrition, which are meaningful from a public health standpoint. Alternatively, they could indicate data entry errors. Distinguishing between these possibilities is crucial because outliers can heavily influence mean estimates and statistical models. The goal of EDA is not just to produce numbers, but to generate insight. For example, differences between groups may suggest health disparities that warrant further investigation. In the next video, we'll visualize our data using ggplot2. Visualization helps communicate patterns clearly and is an essential skill for public health reporting.